Hello, welcome to our presentation. Today we propose integrated solutions to reduce heat stroke comorbidities and fatalities in Mexico. With rising temperatures, urgent action is needed. Our strategy combines both short-term protocols for immediate relief and long-term urban redesign for sustainable resilience. We hope you enjoy.
Heat waves are becoming more frequent, intense, and longer lasting due to climate change. These extreme heat events are no longer limited to certain regions. They are now a global public health concern. One group especially at risk during heat waves is older adults. As people age, their bodies become less efficient at regulating temperature. Many seniors also live with chronic conditions like heart disease, diabetes, or dementia, which make it even harder to cope with high heat. Limited mobility, social isolation, and poor housing conditions only add to the risk. Globally, the impact is already being felt. According to the World Health Organization, seniors consistently make up the majority of deaths during heat waves. A 2023 report in the Lancet projects that between 2041 and 2060, annual heat-related deaths in people over 65 will increase by 370% compared to 1995 to 2014, even if global warming is limited to just 2 degrees Celsius. Most of the diseases are preventable with better housing, early warning systems, community support, and health planning. We can reduce the growing risks for seniors around the world.
Mexico has some general protocols in place to respond to heat waves, but they are not specifically designed to protect older adults. First, there's the early warning system for extreme temperature, and it's developed by the Health Ministry and CONAGUA, and it sends alerts when high temperatures are forecasted and encourages people to take preventive actions. However, it doesn't include targeted measures for elderly people, and its coverage is limited, especially in rural or low income areas. Also, there's no clear data showing whether it's effective in reducing heat related deaths. And second, the government runs awareness campaigns through TV, radio, and posters, and these promote actions like staying hydrated or avoiding the sun between 11 a.m. to 4 p.m. and wearing light clothing. And older adults are mentioned sometimes, but there is no specialized strategies to reach or protect them. And there is also no outcome data showing the real impact of these campaigns on mortality. In short, while Mexico does have systems and campaigns in place, they lack a specific focus on high risk populations and haven't been properly evaluated. Strengthening these protocols with age sensitive intervention is urgently needed.
The gaps we found in Mexico protocols is that there is no national heat action plan. There is no generalized action plan for the whole country. These action plans are not age specific and they don't take into account elderly population. There is insufficient public communication and the coverage is limited to urban areas. Rural and marginalized areas are not taken into account, and there is no published evidence that these action plans work effectively.
Now, moving on to our proposed solutions. In the short term, our data driven approach starts with three evidence backed tactics. One, spatial analysis to pinpoint high risk zones using climate and demographic data. Two, community led initiatives to mobilize local networks for rapid response. And three, nationwide heat health action plans paired with early warning signs to prepare vulnerable groups. These steps ensure resources target those most at risk, especially the elderly and marginalized communities. In the long term, bioclimatic urban design to encourage natural and sustainable means to create cool environments within cities to protect the elderly. Now, for immediate protection, we propose the Preventative Community Heat Stroke Protocol for the Elderly, also known as a PCH-SPE. Here's how it works. First, we'll set up workshops that train the communities in heat stroke first aid. This to make sure that participants within the community know how to treat their neighbors if they're suffering from heat stroke. Then, in phase 1, there will be an early warning sign that triggers alerts via SMS and community loudspeakers. This will notify the people within the communities that there's a heat warning, allowing them to prepare accordingly. Then, in phase 2, nurses within the communities will distribute low-cost wearable sensors to high-risk elderly residents. They will monitor vital signs in real time. Then in phase 3, the local clinics and hospitals will track this data, dispatching medics if emergencies arise. This protocol will save lives now while building community trust. Now, in long-term solutions to permanently reduce urban heat, we advocate for bioclimatic urban design inspired by global success stories. For example, Singapore's green roofs lowered ambient temperature by 4 degrees Celsius. Also, Medellin's green corridors, they cut heat-related deaths by approximately 30%. Melbourne's urban forests chilled vulnerable neighborhoods within the city. And so in Mexico, this means planting native trees, creating shaded public spaces, and retrofitting buildings with cooling materials, turning the cities into natural heat shields. And so in all, together, these strategies create a dual defense. The PCH SPE protects lives today, while bioclimatic cities secure tomorrow. With the WHO's support, Mexico can lead the fight against heat mortality. And thank you very much for listening to our presentation, and we hope that you enjoyed it. Take care.